Yeah, there's such an honor around these families and these babies and the gift of their presence. Even if it's a short life, it's still a life, and it's still a gift.
Hello and welcome to the Restore Healthcare Project. I'm Dr. Jennifer Kang. Thanks for joining me again today. Be sure to like, subscribe, follow, and give us a 5-star review if you're loving this content. We'd love for more people to find us. Today, I get to rejoin my good friend, Dr. Kerry McMahon, who's a maternal fetal medicine specialist in Tacoma, Washington. Thanks, Kerry, for joining us. We have a kind of tough, I would say, but you would say fun topic to talk about today. And so I welcome your joy and your enthusiasm on this. We actually want to talk about value for life in counseling about risk and benefit and the place for truth, for hope, and the unfortunate reality of fear. So that's a big task to jump into. Kerry, you ready for this?
I'm ready.
Awesome. Well, Kerry, in what you do as a maternal fetal medicine consultant, you're right in the thick of life and death situations with patients. Truly, these are high-risk pregnancies. Do you feel through your years of practice that you understand the fear that your patients are feeling?
Yeah, it can be really heavy, really heavy. But I think some of it comes about because the world tries to tell people, and I say the world, like people and even healthcare, have this futility sometimes with things that are hard. And so I feel like patients come in with this incredible fear of what could be, but what hasn't been. And it's also this I think sometimes it can be easy to live in the future or in the past, but God's calling us to live in the present. And so I really work hard with patients trying to get them centered into that place of we don't know what God's going to do. But and that's on him, but we have this hope for what is possible.
So you see that a lot of their fear actually roots itself in perhaps their past, what they've gone through, as well as what they imagine or what maybe even we as healthcare professionals are telling them is a risk of what could be in the future. And one of the ways you've learned to combat that is to encourage them to be with you in the present. Wow.
And to enjoy the moment. Like, I think we can't take grief of what could happen and store it away so that later on, if it happens, we don't have to go through it. Like, you can't bank that. And I think it robs people of the joy of in the moment experiencing a baby. A lot of my patients, had the babies. We say, okay, this looks like this may not be something this baby will survive. We don't know. But right now you're feeling the movements of this baby and you're feeling like the kicks and the patients I feel like, have the most joy through that process are the ones that can be thankful and live in gratitude for those moments. I'm not saying that's easy. That's hard. But I feel like that's this incredible gift God gives people of just be with me in this moment because I don't know what tomorrow is going to look like. And I don't know what's going to happen. But in this moment right now, I'm feeling this baby move and everything looks good. And I'm going to celebrate the gift of this life within me right now.
Do you think that's hard for clinicians to do as well? Do you think that we have a hard time embracing the moment? I think we've been trained to try to think of all the options and to prevent harm and to make sure we're not missing details. And we feel the weight of trying to protect people's future. Yeah. Is that, do we have fear too?
So much fear. I think that it's ingrained in us to make an accurate diagnosis and to give a treatment. And we have so much fear about seeing someone suffer. or wonder what if like this goes sideways, even if that risk is so incredibly low, like I don't want to carry that around on me, like that weight of that. Like, we've, I think at times lost our hope. We've lost our hope of what God can do. And it's funny because I think that, we can get really tainted by our own experiences. It only takes one really bad outcome for us to be afraid the next time we see that thing.
Isn't that so true? And we claim to be such evidence-based clinicians. Like it's such a deep core value for us that we are scientists at heart and we believe the data and we try to be so accurate. And yet I have one experience of that very rare outcome, and deep in my amygdala, I believe that's possible. I now know it's possible, and now it feels like it's more possible than the science told me. That's
Yeah.
a reality within us that is okay to acknowledge. We're not as unbiased as we would like to be.
No. And I see the same thing in patients. Like, I think that human thing of like, when you have somebody that has a really like rare event that happens in their life, like maybe they, had a stroke in pregnancy, or maybe, I've had a couple of patients like this, like, where they've had this like lightning bolt thing happen to them. And they walk into the next pregnancy and it feels like the floodgates of the impossible in the negative side, like are now open. Like they feel like they're at risk for everything, and yet it was scientifically, we know that event they had was so rare and the chance of it happening again is so rare. And I think as docs and as healthcare workers, all healthcare workers, like we see the gravity of the things that could go wrong, and it taints us. Like it really does. Like it starts to cloud our lens of how we view outcomes. And I think it's, it's not God. Like, that pushing down on hope is not God.
Yeah. So the antidote to that then, is it what you just said? Is it hope?
It's
It,
hope.
it's hope. How
I
do
mean,
we
I have
nurture
seen,
that?
yeah, I try and tell patients that are in that really difficult place. I share testimonies because I have seen God just do amazing things, like absolutely amazing things. I'm like, there's a range of possibilities for this. And I don't know where you're going to end up. And my prayer, my hope is you're gonna be way over here. Like, you're gonna be on this side, like, it's gonna be this incredible miracle. But I don't know that. But I'm gonna walk you through with it, and we're gonna have hope for that, and we're gonna stay in this moment, and we're gonna celebrate every moment of this baby's life. We're gonna celebrate every moment of health, like, in this moment, until we get to there. And my job is to keep trying to center them back to living in the moment.
So you're not hiding from your patients the negative possibility. You're not
Oh.
like delusional. And you're like, I'm not going to even talk about that because that's not going to happen. Like you do have a value for truth and you have a value
Yeah.
for truthful counseling. But it's almost like you're saying, I'm going to give you a page. I'm going to draw out for you the truth, but I'm going to have you color that in. We're going to color this together with hope. We're not going to color this page with fear together.
Yeah.
How do you think, I mean, I know this is a hard question, but how do you think it changes the options that you give them for things that they consider to do, to whether it's to reduce risk or to enjoy the moment? Does it change if you were to look at it from fear, like you're trying to prevent all these terrible things, or from hope, like you are expecting that it could go well? Like, does it change the options you give them?
Yeah, I mean, I hope that when we're walking that out, like if something were to go sideways, like we approach that in that moment of how do we manage that? I don't, it's interesting that like I don't really feel like trying to like um push somebody toward like ending a pregnancy, like is, because we're afraid of all these things. Like where is God? God's not in that. Like are we really open to the possibilities of what God can do if we do that? Like where are we giving God space to move? Like I mean God is all about hope. And at the end of the day, like patients have their own autonomy. They have their own right to make their own decisions, but in my counseling of patients, like I really want to approach it from a place of, here are all the possibilities. And if you choose to be over here, I'm going to walk that out with you. And and if you're open to me praying with you, we're going to pray it through. We're going to see what God does. And I have found that like there's more peace at the end of that journey than the other side where we're just operating out of fear. Like we're cutting bait because we're afraid of what it might look like.
Yeah. And I've heard that criticism from patients, maybe even some colleagues, right? Of other of our colleagues, maybe, and we're watching them counsel patients. And we feel like I hear the word fear mongering. I feel like they were just fear mongering and they were telling me all the things that could go wrong and that I should do this one thing because if I don't, I'm gonna die. Um, I actually feel I have compassion for those colleagues. I don't believe they are trying to create fear for patients. I don't think that's their goal. I actually think they probably have the same goal that I have, which is to protect and help and serve these patients, but they're coming at it influenced by fear rather than hope. And they may be unaware that their own fears, like you say, are influencing the options or how they emphasize the risk. Um, I think they are afraid too, afraid of being with that patient in a terrible, very unlikely but possible situation of great loss. Um, I think your message of hope is for those of us too, that there's hope for us to encounter patients at great risk and see a different outcome. Like we need to step out of our fear too and really be honest with ourselves. We're not trying to manipulate patients, are we? We don't want to, but we could inadvertently if fear is so profound.
Yeah. I think underlying some of that too, especially in our field with OB, is, what is a valuable life? Like there's a different definition of it. Like I believe with my whole heart and soul, all life is valuable. All life is from God. Like all life is a gift. And I think that sometimes underlying that sense of what is valuable, like we can superimpose that on our options we give to patients. And I don't think that's most healthcare workers, but that is in our specialty, in my specialty specifically, that is definitely there. And I think it comes not from a bad place. I think it comes from a place of like, I don't want to see this mom and dad suffering, taking care of a child that has a lot of needs because we don't see God in it.
So we feel like we're helping them. Like we don't want them to have to suffer. Like it's going to change their life so dramatically to have such a severely disabled child
Yep.
who
Yep.
doesn't contribute to society. But are we also then communicating they're going to have less value, like that somehow that suffering isn't balanced by the value of this person to this family?
Yeah.
I remember a case that I actually had discussed with you of my own patient who had been diagnosed, her baby had been diagnosed with monosomy X, missing an X chromosome, and on ultrasound had really significant anomalies, including big cysts around her neck that were so big that the potential for this baby to pass away before birth was really high. And from a medical perspective, perhaps the outcome could be grim. Perhaps it actually could be good. It was so hard to predict and what was the math in this situation. But she went to a consultant I sent her to and left feeling so conflicted with fear. And I realized in the counseling that the risks had been emphasized so much that she actually thought that her original desire to carry this baby until either birth or she passed away and to just be in the moment with this baby, that would put her life at risk. She came away with that understanding. And I remember asking you, like, what do you think about that? Is that how you would counsel a patient in this situation? You're in this situation a lot, honestly, aren't you?
Yeah. Yeah. Yeah, I am. Yeah, I had a very similar patient. Yeah, I think it, like I said, I don't think healthcare workers, physicians are doing that to push an agenda. Like, I think it really is coming from a well-intentioned place of I'm trying to keep you safe and I'm trying to protect you. But I think that, if we encourage more people to continue these pregnancies, we would maybe adjust our expectations because we would see better outcomes. like, like we never get a chance to see good outcomes, and people would have better stories because they would be given an opportunity, and I think we have to be really careful as healthcare workers, like how we counsel patients, and we shouldn't be letting fear enter in. Like it should be I'm full like to patients like, hey, this may not go well. Like I think that's important to be honest about. Here's all the possibilities of what could happen. Even to a place of like, if a patient wants to know, here's a percent of this happening and here's a percent of this happening. Like my patients tell me I'm very I'm a straight shooter. I just tell them how it is because I feel like that's important. I don't want to cloud that. But why do we not have hope? Why does fear have a bigger hold in that conversation than hope? Because we don't really know. We don't really know. And even if something happens with that baby, even if the baby passes away, like with your patient or my patient, or if the baby, survives, and does well, all of that, I will say that the patients who get to walk that out in the moment with God, like they feel more whole at the end of that journey. They do. Like I had patients tell me that all the time. Like I felt like I had closure. Like I felt like I gave it to God and I let God do what he wanted to do. And I didn't have a hand like enforcing like something to happen that maybe God didn't want. And the patients, not always, but a lot of patients who feel that push toward doing something out of fear leave that pregnancy. And then I see them again and they're traumatized by it because they felt like I was never given a chance to see what was really going to happen. And like, I have this question mark, like what would have happened, like what could have happened. And did I do something that hurt my baby that I never wanted to do?
Yes. Yes.
Yeah. And moms get really traumatized by that.
That question rolling around in your brain. These are really tough decisions for families to make.
Yeah.
And
Yeah.
if we communicate something to them that they're at risk, then they're also trying to put that into the calculation. We have to be careful that in our desire to prevent risk to the patient sitting in front of us because we're afraid of going through that,
Yeah.
that we actually override their values and what they would be willing. We're assuming what would be good for them. What would they be willing to suffer through or not? That's very challenging to like look at your own values. And I think certainly you say, coming at this from a perspective of, I actually think my second patient, their baby, has value to them, even if this baby can't live. I'm sure that challenges a lot of your colleagues that you believe that a baby who can't live has value. Why do they have value, Kerry? Why do you believe that?
Because every life is a gift. Like that's what I see. I take care of a lot of moms whose babies don't survive very long after delivery. And I often say to those parents, look, what is my hunger for my own children? I want them to make a difference in the world. I want them to walk with Jesus. That's important to me. But I want them to actually, not only just walk with Jesus, but let Jesus come out of them like an extension of their presence. Right. And that's what I see with these babies. Like on labor and delivery, when a mom delivers a baby that doesn't live very long, it rocks our staff in such a beautiful way. And there's such an
talk about that in a beautiful way.
Yeah, there's such an honor around these families and these babies and the gift of their presence. Even if it's a short life, it's still a life, and it's still a gift. And I think those babies, like the nurses talk about patients that walked out that difficult pregnancy and and the suffering that they saw and how they watched these patients like navigate that, and like it inspires them, and it rocks them and it moves them, and these babies, like, they just make such a profound impact on the world in such a short amount of time. And I think about that all the time. I'm like, who's to say that because someone isn't going to go to college and do this, that their life isn't valuable? Like, we don't know what the last day of our life is.
This year, it's more than a conference. It's a movement. Restore Healthcare 2025 in Redding, California, July 31st through August 2nd, is calling healthcare professionals back to the source of their strength. Is it time to courageously assert that healing the healer starts with a dual realm worldview, one that sees both the seen and the unseen? Rediscover purpose, restore resilience, join the movement.
We don't know.
Yeah. And we aren't the ones who get to decide what impact a human life has or judge it.
No.
Or we can watch it, and sometimes it's really obvious, but sometimes we are unaware of the impact. I mean, what impact it has on that immediate family and the people that know them.
Yeah.
And the people that are impacted by the love of that family for that baby. And wow.
Well, and we can, I think if we don't at least give that as an option, because I don't feel like sometimes it's given as an option. We rob people of that opportunity. We really do. And
as a consultant, do you feel that our colleagues, we sometimes do the math wrong? Like, we see a baby that can't live, and we compare that to known pregnancies or known risks of pregnancy in general, right? Pregnancy is not a risk-free situation. But even in the context of modern medicine, there are risks of pregnancy. But do we oversell those risks? We think the value of that baby in the math equation doesn't make sense.
Yeah.
Why would anyone take any risk for the sake of a human life?
All the time. I see that as specifically one of the issues is how babies are delivered. Like, I think a lot of parents really, when they have a child, that there's a good chance the baby may not survive. A lot of docs will push that patient toward having a natural delivery because they don't want the patient to have a C-section for a baby that's not going to survive long. But in that conversation, there's no value to the patient's value for that child's life. And it's a patient choice at the end of the day. But a lot of patients really want to, like, maybe they want a C-section because they know the baby will be born alive and they want that time with that child.
Wow.
And I find that all the time. Like, I remember when I started fellowship, and one of the docs where I was training said to me this really weird question, and I didn't get it at the time. And they said, "Are you for the mom or for the baby?" And I was like, what does that mean? Like, I don't know what that means. And it took me a long time to realize, like, that question is getting at that exact scenario in a lot of different ways. Like, are you going to always put the mom first and the baby's going to be way over here? Like, we're not going to, and I would even question, are we really putting the mom first if we're not valuing what she's valuing? Because why are our values overriding a patient's values?
Mm-hmm.
And if we, and you can have a conversation with, like, a patient, like, what things are important to you? Like, what do you, I always say that to patients, like, what would make this, like, the best it could be for you? Like, how can I orchestrate this delivery so that it's going to be everything you can hunger for it to be? And we'll pray over that. Like, what's that going to look like for you? And it's different for every patient. But that's their values though, not like I mean, I obviously value life, like, that about me, but like, it's a really important part of that care provider relationship with a patient.
Yeah. I think we're confronted sometimes by, I think what I'm realizing is a false dichotomy, that it's either the mom or the baby. And I don't believe that a good God would leave us in that terrible dilemma. it is a dilemma. It does appear to be one. Bioethically, you have two individual lives which we believe have personhood and value, and they are codependent, and the life of one is to some degree dependent on the choices of the other. And does that violate each other? And can it be brought together? And I don't have all the answers to that. I don't have all the expertise in that, but I can say that I believe what the Bible says is true, that one of the great purposes of Jesus coming was to bring all things together in unity with the Father, and that there are solutions to these false dichotomies. It's not either or, it's not us and them. There are solutions, and it's probably on an individual level that God gives wisdom, hope, and covers, protects each individual
Love that.
situation.
Yeah.
But we have to confront that in ourselves, that we do have this tendency to feel like we have to pick a side.
Yeah. I really did think that was the weirdest question. I was like, I don't know what that means. I was like, obviously, I missed that page of the training manual for my fellowship.
But it also goes to show you that in your head, the value that you have for the mother and baby are the same. You don't pick one over the
Why do we have to
other.
make a choice? Why do we have to make a choice?
Yeah. So how would you sit down and counsel a patient? Let's take an example, Kerry, of a baby who's diagnosed with no kidneys, let's say. And that's a baby that doesn't have much of a chance in our current medical technology of surviving. How do you talk to a patient about that?
Well, I'm very, like I told you, I'm a straight shooter. So I'm very upfront about this is what we're seeing, and I draw it out. I'm a really bad artist, so that doesn't always go well for me, but I try and draw it out. I don't know. I like to draw things, even though I'm bad at it. But yeah, I know. I think that's just something with our surgeons, right? We want to work with our hands, but I walk them through that and what that means, and and here's the range of possibilities. And there's a good chance this baby may not live long after delivery, but we don't know that for sure. And we can continue to kind of pray you through this pregnancy and see what God does. And we have seen crazy things happen in the past. And I will journey with that with you. Like I will walk with you on that.
How do you answer questions about risk for mom? Like if she says, is there any risk if I continue this pregnancy? To me, how do you
I don't think
approach that?
Not with that particular, like with renal agenesis, when the kidneys are missing, like there's no risk to mom. I think if a risk does show up, like let's say she starts to get high blood pressure and she's 27 weeks or whatever, and she looks like she's getting like something called preeclampsia, like if she's getting sick, no different than any other pregnancy, like you tackle that issue as it comes and you give appropriate medical care. Like the condition of what's happening with the baby doesn't supersede like normal medical obstetrical care for that patient. But yeah, I think, and it's funny, like this is the world we live in. Like, I don't think there's a single patient that doesn't know they can terminate if they want to. But I don't think many patients know they can continue. And that's what I found. So are we really giving people a balanced list of options? Because I find that really interesting.
And you've said this before, but I'm going to ask you to kind of say it again, which is why do you think that we would want to counsel in a way to encourage them to close the chapter and terminate a pregnancy?
Yeah, I think this is just fear. It's fear. It's fear of seeing somebody suffer. It's that fear of that weight of responsibility I think we feel as healthcare workers to care for someone and to make sure they have a good outcome. And good outcome to us may mean that they don't suffer, that they don't have emotional suffering from a loss. And so I think, in our perspective of patients, maybe with your patient with cystic hygroma, like where there is this risk, Like if they choose to end the pregnancy and they close the chapter, in our brains, we're done.
Wow.
Like that's the end of our suffering, but it's not the end of theirs. It's not the end of theirs. And I feel like a lot of patients are very traumatized by those interactions with healthcare. I really do. And I see them come back and they this is what I hear all the time. You know, that they didn't feel like somebody was walking with them, that they did something they weren't even sure they wanted to do. And now they have all these questions of like, what if I had continued? Like I think there's such a closure to letting God decide how he wants the story to end. And when we try and end the story, based out of fear and the possibility of that this thing could happen, when in medicine those things happen all the time and we deal with them in the moment. Like I don't know, like we would never say to a patient who had preeclampsia, like in a prior pregnancy, well, don't get pregnant again because you're going to get preeclampsia. Like, you know, like we wouldn't do that. Right. So like, I think it's this in our brains, maybe we have this risk benefits ratio of like this, I'm not sure I value this life that won't last very long. And here's this risk. And even though it's like a low risk, maybe that risk in my brain is going to override the risk of what I think is value. But it's what I think, not what the patient thinks. That's the problem with that.
I think you're also challenging this idea. It's an assumption that somehow ending it early reduces suffering.
Oh,
And
yeah.
is that not your experience? You've walked all these scenarios out with so many hundreds, thousands probably of patients.
Yeah. Yeah.
Do they suffer less?
No.
They suffer differently.
I think they suffer more because there's that question. There's that question.
I think as a society, we might be a little hesitant to acknowledge that there is beauty and love to be found in things that look like suffering.
Yeah.
We try to avoid pain, right? Like, why would you want to hold your baby as it watch them die? Why wouldn't you? And a mother who's done it might be able to give you some perspective.
Well, and it's funny you say that because I have a list of patients that say to me, like, if you have another mom with this, I'm available to talk to them because I want them to know what it was really like. And they're going to share things that I don't know because I wasn't the one going through it as a patient. They're going to share highs and lows that I may have no insight into. But I think that's such a beautiful thing. But I have never, like in my 15 years, had a patient that walked that out that didn't have beautiful closure around it. And that child wasn't part of that family in a way that there seems like something's missing when a pregnancy is ended early, you know. That's my experience. Yeah. And, go ahead.
And you yourself seem like you feel added to because you've had the opportunity to be there with these patients. Do you feel traumatized by?
Yeah. I mean, I a long time ago, I just decided like, I don't want to get acclimated to suffering. Like, I don't want to be. So I allow myself time to grieve. And I do cry when a patient loses a baby. I do cry. Or when when I lose a mom in the ICU, I cry. And I don't care if people see me crying because I'm human and I don't want to lose touch with that emotion. And I know like I can give that to God. Like I release that to God and it's not I don't wallow in it, but I don't want to lose that ability like to experience those emotions. Cause I feel like that's going back to that place of like, we put up this wall. Like if we put up a wall against pain, well, we've also put up a wall against joy. Like you can't like have one and not the other. And I know that because I've lived it and I don't want to go back to that place. Like, I don't want to go, like, there's that wall that goes up, right? Like, we're going to protect ourselves. We don't want to experience like the pain of what somebody else experiences. And I'm a highly empathetic person. Like, that is me. And I think some people aren't like empathetic. and it's harder for them, and it may be easier without putting up the wall, but there's also this importance of how we connect with patients through empathy that can be learned. And that's important. But I just know that for me, like, if somebody has a loss or something difficult, I'm gonna experience it with them in the moment, and then the Lord takes it. But yeah, that's okay.
Yeah. And it sounds to me like you're saying, by saying, if you put a wall to pain, you won't have joy either. You're saying joy is worth pain.
It's so worth it.
Hmm. And you have seen some miraculous turnarounds, Kerry, in so many patients' lives. Can you think of just one out of that long list where medically we would have said this is not likely to go well, and the pregnancy was carried through, and the outcome was miracle?
Yeah. Well, the one that's coming to mind, there's a lot. Like, God has been very gracious and good. I remember getting a call. I was on call, and I was super tired, and I probably didn't have my Jesus praise hat on the moment. Like, I just really know. I was maybe not like walking with the Holy Spirit in the moment I got this call. But I got this call from this patient. She was like really early, like before a time where we could resuscitate the baby. And she was in the hospital, and she was like almost close to delivering the baby, like really significantly dilated. I like, in my fatigue, in my humanness, I was like, I was that doc that said, like, I didn't think there was hope. And then the next morning I came and she was still pregnant. And her doc came out to me and said, "Will you come and see her?"
Wow.
And I was like, yeah, God's always teaching us, right? Okay, Dr. Kerry.
Oh, ye of little faith. Yes.
Yes, I know. So I walked into the room, and I was talking to her, and I said, this is like, I didn't have hope until she looked at me and she said, "I want whatever we need to do to save this baby's life. I want you to choose the baby over me." And I was like, and then I kind of got shooken out of my fatigue. And I was like, "What am I doing, Lord? Like this is you. Like I'm not walking in you right now. Like, I need to change my attitude." So I said, "Well, let's pray about it." And I had examined her before, and there was literally like, this was not going to go well from my exam. And we prayed, and she started to cry. And I was like, I could feel Lord moving, like Holy Spirit was there, like moving in the room. And I said, like, "Okay, like, let me examine you again. Like, let me examine you again." And I examined her again, and it was significantly better.
Wow.
Significantly
Like her
better.
cervical dilation receded.
Like, she receded. Like she went from like 9 centimeters to 5.
What?
Yeah. And I was like, okay, Lord. Like, snap me in the face. Like, okay. And I just thought, okay, like, Lord, what do you want me to do right now? And I heard him say, like, take her back, like, put a cerclasion, like, take her back, put a stitch around that cervix, like, take her back. And, the funny thing about that is, like, there was this unified kind of front on labor and delivery in that moment of people wanting to make that happen. Like, and that isn't always the case. Like, sometimes I feel like I'm battling with like labor and delivery, like trying to like, come on, like, we need to do this. But they were like, no, like, let's go. And they don't normally let me do that procedure up on labor and delivery. They make me go down to the main OR. But that particular day, they were like, "We're rolling her back right now." And they knew the gravity of it. Like, they knew what it had been and the gravity of it. And so I was praying the whole time, like, "Lord, like you just show me where you want me to do what you want me to do. Like, your hand is mine. Like, whatever needs to happen, Lord, like we'll just do it." And we rolled her back to the OR, and I was so surprised. Like, that moment where you're like, okay, like, this is really happening. Like, and I it was one of the easiest cerclages I've ever done. I was like shocked. I was absolutely shocked because I was like, I even had called another doc back there to push up the membranes and like, like this is a high risk surgery at that point. Like the chance of us breaking the bag is like off the hook, right? So we get this cerclage in and we roll her back to her room and I prayed with her one more time. And then I left and her nurse texted me at 1 a.m. and she said, that patient you put the cerclage in, she was so angry with God for most of her life. And this experience like opened her heart to him again. And I was like, okay. And it was so good. And like she went all the way to the end of pregnancy and had that baby. And I really like, I mean, that's me and my own, like, I need a renewal of the 9 sometimes too.
And just the kindness of God to draw you into that, to give you a moment to catch on to what he was doing and to let you agree with hope instead.
Yeah.
Wow.
And that realization too, that humility of like, this is something I have to keep working on. Like, it's not like I'm not 100% there. Like I get so fatigued and then I forget what we have access to. Yeah.
So we need each other. We need each other to remind each other of the stories of hope that we carry. And that to stay in that place of humility, if we don't actually know, we only have some statistics to try to predict, but we don't actually know. And sometimes we might make a different decision of what we could offer if our mind was influenced by hope instead of just by fear. Thank you for this fantastic conversation. I'm sure it has really challenged a lot of our listeners. And I think for me, it just gives me such gratitude that we get to know each other and we get to spur each other on to greater things, greater hope. Thank you so much, Kerry.
Thanks, Jen.
Oh. And thank you to all of you for joining us today on this conversation about hope, fear, and the place for more. I'm Dr. Jennifer Kang, and this has been the Restore Healthcare Project.
Is science and medical innovation at odds with faith? Or could it be that God loves to co-labor with us, bringing healing, compassion, and restoration to a broken world? Join us at Restore Healthcare 2025 in Redding, California, July 31st through August 2nd, where healthcare professionals, scientists, and innovators come together to explore a courageous new path, a path where faith and medicine aren't divided, but they're united by love, purpose, and the power of a dual-realm worldview. Register for this conference today. Let's restore healthcare together.